Let's get more on the fears associated with the new bird flu outbreak. Ian Mackay is an associate professor with the Australian Infectious Diseases Research Centre at the University of Queensland. He joins me now from Brisbane. Dr. Mackay, thank you so much for joining us. What is your view on this latest statement by the World Health Organization, and just how serious is this new bird flu strain?
The new statement is in keeping with how seriously we need to take this virus. It is an emergent virus, that is, we haven't seen this virus before, it's brand new. It does cause deaths, it seems, in China. The total death toll now is up to 26, as of some new numbers I've just received. And therefore we have to take it seriously. This has happened over a period of 4.5 weeks, quite a short period.
Currently, Doctor, it's in its early stages. How should we get ready for it?
The best thing to do is take the advice of the World Health Organization. So not panic, but be aware, keep our health professionals informed of what's going on. Our health professionals have a lot of plans in place from previous pandemics, so they know what to do, what to expect. And we have to keep an eye on these numbers that come out of China and hope that they keep coming out the way they are.
But on the flip side, Doctor, isn't it too early to jump the gun?
It certainly is. We don't know a lot about this virus yet. It's very early days. So we can't panic, and we shouldn't panic, and we shouldn't make too many assumptions or presumptions yet.
And going forward, what do you think will come out of this?
One of two things are going to happen. We're either going to see sustained human-to-human transmission of this virus and a spread around the world, and we may see a pandemic, or it may continue on very low numbers and fizzle out a little bit, still causing illness and disease, but not causing a pandemic. Which of those two avenues, which paths are going to be taken, we don't know yet.
All right, we had SARS close to 10 years ago. What lessons can we learn from that experience that we can apply to this new bird flu strain?
We've had a number of lessons already acted on. I guess the main thing is the information that's coming out of China has been a lot more transparent and common than we saw with SARS. So that's an important point. The world needs to know what's going on. Other things include pandemic preparedness. Hospitals and healthcare professionals are now on the lookout for these sorts of serious conditions, pneumonia, fever, influenza-like illnesses that aren't positive for normal influenza viruses.